Yeah, okay. Okay, I'll answer this. So I did a post some weeks back saying that hip replacements post-operatively don't need much physio, if at all. And with knees, I've said that we tend to go quite judiciously initially, and then maybe after the soft tissues have healed, then we might need a little bit more, but sometimes we might not need much. That created a lot of consternation, I would say, especially amongst the physios in this group. And I'm just going to address a few of these points. First of all, my population is generally a bit younger. Okay, so they don't really need to be assessed for safety and falls and all that sort of thing. And they can usually, and if they're motivated, they usually get on and do an awful lot of this themselves, particularly, I'm talking mainly on the knees. Secondly, there was someone who mentioned the fact that they need it straight after the operation when they're an inpatient. That's absolutely correct. I should have made that clear at the time. I rely heavily on inpatient physio, but I'm talking about mainly outpatient physio and whether you need it afterwards. I did a post some months back where I said the mistake you can make with a knee replacement is that you can either do too little or too much. And so I'm not saying that physio is not necessarily needed, but we do need to be not so aggressive in the first instance, because essentially it's a soft tissue operation. It's not a bony operation. So I hope this clears things up. But yeah, on the whole, hip replacements, I'll stick with that unless they've had a long-standing problem where, say, there has been some gluteal weakness and they've been leaving this hip for many, many years and their muscles are basically wasted over that joint. They don't necessarily need that much physio afterwards.